students can also see.
Definitely. Thank you so much.
Most welcome, ma'am.
It's my pleasure.
The program is live now, ma'am.
Yeah.
So, good evening, participants. Thank you for joining Shield Connect today. And today we are going with the series Icons in Conversation with Dr. Ritu. And the topic is cardiovascular health and menopause. And the speaker, icon speaker is Dr. Sheikh Zinat Nasreen. Ma'am is from Bangladesh. And our speaker and organizer is Dr. Ritu S. Santwani. So before we start the session, let me give a little introduction of our page also, Shield Connect. So this is our page Shield Connect, where you can find various sections are available. The first section is the blog section. So you will find all the blogs written by the top speakers and experts who are connected with Shield Connect page. Then we have a webinar page where you can find all the upcoming webinars available on our page. Then we have awareness pages. So if you click on PCOS awareness page, you will find all the details regarding PCOS by different doctors in different languages. Then we have a special day section, GDM special. So you can, if you click on GDM, you will get all the videos related to GDM. So this is our page. And now let me give introduction of our organizer, Dr. Ritu Santwani. Ma'am is Ma'am has 20 years of experience in obstetric and gynecology service in cosmetology and IVF. And ma'am is passionate about sharing the knowledge and welfare activities and hosted more than 1,000 webinars and training and awareness program for public, corporates, and medical.
Now, please welcome our guest.
Okay. So our special guest, Professor Sheikh Zinat Ara Nasreen. Ma'am is done MBBS, MPH, FCPS, FIAOG, MRCOG, FRCOG. Ma'am is professor and head of ZH Sikdar Women's Medical College and Hospital. Ma'am is chairperson of Scientific Committee of Obstetric Gynecology Society of Bangladesh. Ma'am is also Secretary General of Bangladesh Menopause Society and Member Secretary of CPD Committee of Bangladesh College of Physician and Surgeon. Ma'am is Secretary General RCOG Representative Committee of Bangladesh.
Enough.
Let him introduce.
Yes, ma'am. Yeah. And ma'am is also course director and facilitator of LS program of Bangladesh and having national and international publication. So we welcome you, ma'am, on our platform, and I will hand over the session to you.
Yeah. Thank you, Nishant. Thank you, Nishant, and thank you, Shield Pharma. Big thanks to Prachi, Nishant, and Chitrakala. So, friends, as all of you are aware of this program, the Icons and Conversation with Dr. Ritu, here every Thursday, 8 to 9 p.m., we are having a discussion with one of the stalwart who has done a lot of studies and lot of publications and who is passionate about the knowledge sharing. So today we are having a I am very much delighted to welcome our very dear friend and very great madam, Dr. Sheikh Zinat Nasreen. Madam, a very warm welcome to you. Friends, a while ago, madam has just landed in Bangladesh from St. Petersburg. Ma'am, I have a big salute to you. What a dedication you are and what a commitment. What you committed me that you will come to my program. And madam has landed, I think, only a while ago. Even though having such a hectic schedule, madam has accepted my invitation. So madam, we are really honored to have you with us on this platform.
Thank you.
So friends, as all of you are aware, today we are going to discuss the cardiovascular problems and menopause. So who will be the best speaker for this topic other than madam? So without much delay, so I am handing over the session to madam. After the madam's talk will over, we will have some live question discussions. Yeah, Chitra, please start sharing the slides. Ma'am, the dais is all yours. Yeah.
Okay, thank you so much, Dr. Ritu Santani, and all wonderful, kind words from Mr. Nishad. And of course, I'd like to extend my heartfelt gratitude to the organizer, as well as you, to invite me in the conversation with icons. I'm so happy to be here with all of you. And definitely, I hope that there will be interactive session too after my presentation. Thank you, Dr. Ritu Santani. Thank you very much. Well, today is my topic, cardiovascular health and menopause. Well, actually, can you share this one? Can you move the, yeah. Well, all of you know what is menopause. We know everything, but actually the menopause, not everyone, but it may sometimes produce some bothersome conditions like, hot flushes, night sweats, palpitations, osteoporosis, genital syndrome of menopause, and also, the most importantly, it increases the risk of cardiovascular disease. Cardiovascular disease, all we know, it could be the coronary heart disease, ischemic heart disease, myocardial infarction, hypertensive heart disease. This transition to the menopause is associated with increased risk of cardiovascular disease. Ladies and gentlemen, I'm going to talk with this issue today. I like to discuss why it is more riskier for women to have cardiovascular disease after menopause. What is the issues? What are the relationship between the menopause and this risk? What are the contribution of estrogen, and what is the use of MHT regarding this issue? And lastly, the prevention. So can I move myself? No. So move it, please. Can you move the slide, please?
Chitra, please change the slide. Yeah.
Actually, in fact, 1/3 of all death of women after the age of 50 occurs due to the heart disease. And therefore, women need to adopt the strategies to prevent this heart disease and cardiovascular disease to maintain a good, healthy heart as soon as they reach or approach towards the menopause. Quickly, please. Well, so menopause, it is not always worse. It could be a newer opportunity. Why? Because it can also be the start of a new life and a rewarding phase to the woman's life, and the opportunity that all women can guard against the major health issues. And those are the heart disease and the osteoporosis. So if we look at the epidemiology, heart disease risk rises for everyone. I mean, both for men and women as well when they age. But beyond menopause, this risk for the women increased dramatically. And by 2030, almost 23.6 million people will die from the heart disease. Indeed, epidemiology evidences suggest that menopause increase 2.6-fold more cardiovascular disease in women. Both early menopause and premature ovarian insufficiency or primary ovarian insufficiency increase the risk about 1.5 to 2-fold in the cardiovascular risks. In young women who have early menopause and not taking MHT, they're also at a rate of high increased risk of cardiovascular disease. Next, please. And the rate of this disease, cardiovascular disease, unfortunately, is high in developing countries and almost double that of the developed countries. Nag, T, and Ghosh et al., they have a very good publications, and they identify the risk factor in Indian population. They found that the people are dying from heart disease in a younger age and below the age of 50, and that is about 52% in India. Next, please. And not only that, even if you look at the European countries, the data says the incidence of cardiovascular disease is 9 times higher than that of the breast cancer. And the cardiovascular disease is not only in Asia, all over the world, so it become a global issue. Therefore, and why? What is the reason that cardiovascular disease or risk is high after the menopause? This is a very good study by Pradhi from Nepal. They had community-based research. They found that the hormone changes after menopause, I mean estrogen deficiency, high LH, and high FSH, are significantly related to the alteration of the plasma lipid and inappropriate and lipoprotein metabolism. Also, they have found, next one, please. They have found that estrogen is a cardioprotective, and it actually helps to maintain the vascular tone, and it also keeps the blood vessels flexible. It increases the good cholesterol, and it decreases the peripheral resistance. Most importantly, estrogen reduces the tumor necrosing factor alpha and increased prostacyclin 1, which reduces oxidative stress and platelet activations. Thereby, this Pradhi, they have proved that this estrogen is a blessing of women and it is a cardioprotective. Next, please. So, once there's a menopause, we all know there's a estrogen deficiency. This estrogen deficiency negatively impact on the metabolic system, such changes of the body fat distribution from gynocoid to the android. I mean, there's a total androgenic shift. It reduces glucose tolerance, alters the lipid profiles, increases blood pressure, increases sympathetic tone, causes endothelial dysfunction and the vascular inflammation. And these all are the surrogate markers for the cardiovascular disease. Next, please. And beside, we know that there are a lot of risk factors beside the age and the menopause. Those are, smoking, diabetes, raised blood pressure, high lipid, LDL, obesity, sedentary lifestyle, and the family history. These all are the risk factors for the cardiovascular disease. If we look into these risk factors, we can find the diabetes, raised blood pressure, high level of cholesterol, obesity, and sedentary lifestyle are much more common in women than men. So we can understand that menopause, age, and all these factors, everything actually leads to the cardiovascular disease risk. And interestingly, the women who are suffering vasomotor symptoms, and we know that the vasomotor symptoms predominate all those symptoms of menopause. About 75 to 80% women suffer from that. And these vasomotor symptoms are associated with the high blood pressure and altered lipid profile, that is cholesterol profile, and they're associated also, they lead to the risk factors to cardiovascular disease. Next, please. And another important thing that we have seen that there is an androgenic shift. Testosterone level is increasing towards the age. That leads also the metabolic syndrome. So the menopausal women are prone to develop metabolic syndrome. Next, please. There's a wonderful, systematic review and meta-analysis by Martel and S. And they included 951,000 women, menopause women, and they found that yes, metabolic syndrome is more in case of women, and they cause the increased risk factors. Twofold increase the cardiovascular risk of those women. And also, the Jason, he found that in study of women's health across the nation that testosterone progressively dominates during the menopause transition, and the prevalence of metabolic syndrome increases independent of age and other covariates. Next, please. And we have found, I already discussed about the estrogen when it is beneficial by increased vasodilatation, decreased inflammation. I have already told that. Please skip next one, please. So then we understand now that yes, menopause itself is a risk for increased cardiovascular disease. So what about the MHT then? What about the menopause hormone therapy and cardiovascular health? Well, the estrogen of hormone replacement therapy reduces abdominal obesity, then visceral obesity, insulin resistance, and new onset diabetes. Also, the lipids and blood pressure and adhesion molecules are decreased by this MHT in women who are not having diabetes. And also, it reduces insulin resistance and fasting glucose in women who are having diabetes. So, next, please. So we understand that hormone replacement therapy could be the beneficial for women, but there are huge controversies. Should we prescribe the hormone routinely or selectively, and whether it is actually beneficial or not? A lot of controversies are going on for last 20 years. Back in 2002, though it was started 1998, the HARS study, they showed that there's no preventive effect and there's a risk of cardiovascular disease or coronary heart disease increased by 50% in the first year of the MHT treatment. But later, there are a lot of meta-analysis showed that no, actually, this is not the whole truth of the MHT. We found a lot of other studies. Please show the next, please. In 2002, WHI, that is Women Health Initiative study, that actually published a very alarming result. That is, they showed that if combined estrogen progesterones are taken by 1,000 women for 5 years, the risk of cardiovascular disease or coronary heart disease increases 2.5 additional cases. That is actually really alarming. So for women, should we prescribe hormone or not? There's a great debate. So debate was going on and lots of studies are done. Please next slide. As we are scared by the HARS study and Women's Initiative Health study, a nursing study, also Millennium study, they showed there's an increased risk of cardiovascular disease, coronary heart disease for the women who are on MHT. But post hoc study of WH study showed that there is a lower incidence of cardiovascular disease in women taking MHT within 10 years of their menopause. I mean, who are within 60 years of their age. Also, the evidence from systematic review of observational studies suggests that the MHT may have beneficial effect in reducing the incidence of cardiovascular disease events in postmenopausal women. So it should not be, the other studies also mentioned that yes, it can be used, no doubt, but it should not be used as a primary prevention. That was actually published in American Public Health in 2013. Next, please. So in 2009, the Cochrane collaboration, there was a study including 41,000 women. The author's conclusion is like that. Yes, HT can be beneficial for short term, but it doesn't prevent the progression of disease, doesn't prevent the progression of disease. So there's no point of giving MHT in women for the prevention of primary or secondary heart disease. Next, please. But, the studies kept going on. And in 2013, the global consensus statement, which was actually issued by most of all menopause societies, like Canadian societies, British menopause societies, American menopause societies, all came into conclusions in a consensus, which was reviewed by the Cochrane database. They said that a standard dose of estrogen alone may decrease coronary heart disease and all causes of mortality in women when they're young. I mean, within the 10 years of our menopause or below the 60 years. And that was supported by many, many good publications. I mean, D. Weller's publications and the studies of the climatic, they also supported this one. Next, please. So the role of MHT also been evaluated by NICE guideline. And in 2015, they clearly mentioned that benefits of MHT depends on timing of initiation and dose and duration of the drug. And they also agreed the consensus of 2013, global consensus, that estrogen will be protective of atherogenesis in women who have no atheroma, who are younger women. And if the MHT is given to the elderly women, it doesn't help because already atheroma is formed, rather they'll help in the progression of the disease. So it is actually timing hypothesis. But WHI, there what happened, the study was really biased because all the women they recruited were quite elderly, more than 60 years of age, and only one dose of estrogen was used in that case. So the cardiovascular events were very high. But also post-hoc studies said that who are younger, I mean less than 60 years, I mean this group of women, that is 50 to 60, they were benefited. And the risk of the cardiovascular disease were less among this group. Next, please. So after that, lots of publications were there, but the longest 10-year study by DOPS, Danish Osteoporosis Study, and the Finnish study, they clearly reported that women taking MHT had reduced risk of mortality, heart failure, myocardial infarction, and without they have got much risk of stroke and VTE. But at the same time, that KIP study, I mean, Kornos Early Estrogen Prevention Study and ERA, that is Estrogen Replacement Study, they didn't find any benefits of estrogen on the thick and intimate ratio in a group of women who are using MHT or who are not using. But later, next please, that ELITE study, which is a very, very long and randomized control study and a very good study, that is early versus late estrogen therapy study, showed clearly that women who got early estrogen, estrogen at early age, and there's no atheroma, the progression of atheroma is less among them. But if there's already slight atheroma, that's elderly women, the prognosis is not good. So ELITE study also, it is published in 2016, New England Journal of Medicine. So it is clear to us that women who are young, less than 60 years of age, and within 10 years of menopause, and apparently healthy women, the benefits of MHT is quite high. Next, please. SMART study. That is another study where they took the selective estrogen, serum, selective estrogen modulator with conjugated equinesterone. And that study is also proved that within 12 months, the combination used by the women where they have seen that it is associated with a significant improvement of the total cholesterol level. I mean, high density lipoproteins is quite high and low density lipoproteins is quite low. But one thing is a very prominent, that women who are having already heart disease, if they take MHT, it might produce a high risk of DVT or thromboembolism. Next, please. And this is actually published very recently, I mean, April 2021. And wonderfully, they have written details about the estrogen and progesterone therapy and risk of cardiovascular disease. What they have highlighted, can you go down, please? Yeah, they highlighted whenever we are thinking to prescribe hormone replacement therapy to a woman, definitely you have to assess the risk of cardiovascular disease. That is very important because we never know whether she is at a risk of cardiovascular disease or not. So, of course, MHT should be given for the clear indication. We cannot prescribe MHT. Women is coming and asking you to prevent the heart disease or osteoporosis. I mean, osteoporosis now is excluded or something. It's not like that. They must have clear indication for which we have to prescribe the MHT. But before that, I'm not going into details, but what I can say that if they have got the disease and they're high risk of cardiovascular disease, avoid MHT. That is the best one. We will avoid. If there's a risk, a definite risk, but I mean, hypertension, diabetes, and high TG, then what we want to do, we want to control them, and then we can prescribe the MHT with cautious. And if there's a low risk, I mean, there's no risk factors, we can prescribe MHT. So risk assessment of cardiovascular disease is very important before prescribing the MHT. Next, please. So before starting MHT, we all know that we have to take a meticulous history and we have to go for the detailed physical examination. It is known to each and everyone. But what is important in the point of view of cardiovascular aspect, that before prescribing MHT for clear indication, all women must maintain the body mass index. And it's better if it is less than 25. And it's better they can maintain if their waist size below 35 inches. And if they have got the hypertension, diabetes, dyslipidemia, that has to be controlled, optimum. And women are advised to maintain their blood pressure 120, 80 and below. And they need pharmacotherapy if their lipid profile need to be optimized. But most importantly, and lastly, it is imperative that both the patient and providers must aware of the appropriate indications for MHT, why she came for. Is it indicated for her? If she really needs that, yes. And then, of course, we have to also discuss with the women the risks and benefits on the point of cardiovascular standpoint. Next, please. Okay, once we decide that we have to prescribe MHT and she's fit to get the MHT and she badly needs that, then we have to prescribe, no doubt. Regarding the progesterone, because we know that progesterone has androgenic effect, so we may choose a natural progesterone or dihydrogesterone. Then androstenedione also can be chosen because it significantly lowers the blood pressure and it is anti-mineralocorticoids. Next, please. So if we look at the IMS, International Menopause Society's updated recommendation, they have clearly highlighted that cardiovascular disease is the principal cause of morbidity and mortality in postmenopausal women worldwide. And there is evidence that estrogen therapy may be cardioprotective if started around the time of menopause, within the 10 years, and continued long-term without, much risks. Transdermal estrogen, that is lower than 50 microgram, very low dose estrogen combined with the microionized progesterone appears to be the safest choice. And in regard to actually thromboembolic and stroke risk. And also that recently in 2019 March, it is updated that use of low-dose oral transdermal hormone replacement therapy appears to be safe with regard to cardiovascular risk in women in menopausal transition and within the first 10 years. So all the data, all the publications, all the studies actually highlighted to get the window opportunity of 10 years of age, that is young age. So let us open the window and take that opportunity that women should be young, below 60 years, within 10 years, apparently healthy. We can prescribe MHT where the benefits will more than the risks. Next, please. Okay, it won't be stopped. I can't stop my presentation until I talk about the prevention of cardiovascular disease. That is the most important part. The women, when reaching near the menopause, we have to educate them. Information dissemination is important because in many parts of the world, women are not aware that when they're reaching to menopause, cardiovascular disease could be alarming for them. They have to know that, and prevention need to be advised. And prevention, next please. Prevention is the same. The prevention is the most cheapest and most efficient strategy to prevent the cardiovascular disease and to maintain the good cardiovascular health. So that should be the top priority. So we have to advise them healthy diet. We have to avoid them to quit smoking. We have to tell them to maintain their body weight, to have healthy diet, and treatment of the comorbidities, like if they have got the hypertension, diabetes, metabolic syndrome, hyperlipidemia, that has to be controlled. And of course, we also tell them to explore what brings them pleasure. We need to reduce, they have to take care of themselves. It is a time for self-care, so with the positive thought. And they also love themselves and revive, not retire from sex too. This all, prevent the cardiovascular risks and diseases. Next, please. And finally, I'd like to stop my presentation by saying that exercise, exercise, and exercise. If we look at the cardiovascular risk, only exercise, only healthy diet that is the most beneficial, that may prevent the danger of the risks of the cardiovascular disease and the metabolic syndrome. So whatever they like, I mean, they can walk, they can cycle, they can swim, they can dance, whatever is feasible for them, they can do it. But yes, 150-minute per week, a moderate exercise is advisable. And who are having higher BMI, they can do more. And also muscle straining exercise need to be advised. Next, please. So I'd like to conclude that prevention of cardiovascular disease in women should be started as early as possible. I mean, from the mid-30s. And menopause is the time to have checkup, including the assessment of the cardiovascular risk and to start a healthy lifestyle. Decision for MHT should be individualized. It is very important. I mean, that is, the provider should have a wide knowledge about the MHT, and then the women should be individualized, tailored according to the symptoms of patient and their preference, and whether they have got any risks for cardiovascular disease or other disease like thrombotic episodes or breast cancer. MHT is not be used for the primary or secondary disease prevention of cardiovascular health, but women need to start MHT earlier in order to get the maximum cardiovascular protection. It is strongly recommended in women with early menopause or primary ovarian insufficiency, as these women, if left untreated and are deprived of estrogen, are at risk of cardiovascular disease, osteoporosis, dementia, and so on. Transdermal estrogen have a lower risk of thrombosis compared with oral regimen. And concerning the progestogen, natural progesterone and dihydrogesterone have a neutral effect on cardiovascular risk factors. So I'd like to highlight here that actually we need more rigorous research in our Asian perspective. We have a lot of researchers from European countries, which I have shown today, but still we need to do more and more research to understand the hormone replacement therapy, menopause, and cardiovascular risk. With this, thank you. Thank you very much. Thank you very much for your kind attention. Thank you, Dr. Ritu Santani.
Thank you so much, ma'am, for such a very crisp presentation. You have cleared a lot of our confusions. So friends, if there are any questions, please put in the chat box. So yeah. Ma'am, we have received some questions. With your permission, I am going to read that.
Yeah, sure.
Why the females are more prone for cardiovascular disorder after the menopause age? Madam has just covered all the things, but even though we have, some doctors may have joined little late.
Okay, thank you. That is actually the most important question of today's topic. I mean, first of all, I already said that age is an independent factor. The more age, the more the chances of cardiovascular disease. But due to menopause, the estrogen deficiency results the metabolic changes, androgenic shift, and dyslipidemia. These three actually produces cardiovascular risk. And top of that, women are having more obesities, more sedentary lifestyle, more diabetes, and more hypertension. This all together actually make them more vulnerable.
Thank you so much, ma'am. One more question I will see. Is there any difference between the women who receive hormone replacement therapy closer to menopause versus those who start later?
Well, that is actually very, intelligent question. Most of the studies, I have already mentioned ELITE study, early versus late estrogen therapy. That's a very randomized controlled study. They proved that if women starts hormone replacement therapy in early age, the progression of atherosclerosis are far less, and the beneficial effect of estrogen is prominent. On the other side, if the women at late age, they start, already there's atherosclerosis starters because of the age. So at that stage, the benefits are not that much when they are getting in young age.
Very true. Thank you, ma'am. As madam has also mentioned in her talk also, and also clear cut from the guidelines also, that within 10 years of menopause and up to 60 years of age, we have to give whatever the MHT we are giving. So, ma'am, there is another question from Dr. Crow. Dr. Crow, a dear friend from all the way from the Egypt, she has joined. Yeah, hi, Crow. She is writing how we take follow up on the women who are on HRT.
Well, thank you, Dr. Crow. Thank you that you have joined with us. Well, that is actually in general, I mean, not for the cardiovascular disease. Any women who have started MHT for a clear indications, definitely you have got all the information about the lady. So it is always better to see her 6 months later, how she's doing, what she's doing, whether she's getting benefits or not, is there any problem. But you have to give some alarming ideas or advices that whenever she's feeling something odd, she should come to you. But within 6 months time is fine. And then 6 months time is the most appropriate time. But by this time, many things may change. So I think that is the most important follow-up schedule.
Yeah. Thank you. Thank you so much, madam. Madam, I want to know your opinion. In Bangladesh, are you using some other supplements, some herbal supplements or some other therapies for this menopausal symptoms? Because in India, there is a wide variety of supplements we are getting. Yes, though we are giving some hormones, but in some patients, the non-hormonal preparations are also giving very, very good results.
Yes, Dr. Ritu, you're absolutely right. And we have seen that in our part, the women are very oblivious to complain to us, right? So, the IMS and everywhere, what we advise our younger doctors to be proactive, ask them questions regarding the menopause symptoms. So whenever the elderly ladies are coming to us, when we are getting the information, we understood that she is having something wrong. Then probably we offer her, if she needs, that MHT and other lifestyle modification. Most of the women, they are very much, they are not keen to get the MHT. So in that case, we are also prescribing some herbal. But in Bangladesh, we don't have much herbal. Only we have getting the soya, black cohosh, and red clover. These three are available there. Okay. So this is, good. But still, the evidences are not that enough to say them that they're evidence-based.
Very true, ma'am. Ma'am, because here also, I am based at Pune in India. So here, yes, as you rightly said, here also most of the patients are not ready for MHT. And one additional problem, what the patients I am getting, some are having, some are smokers, some are addicted to alcohol also. So patient when are coming with these symptoms, they already mentioned by themselves, ma'am, I am a chronic chain smoker. Yesterday I have a patient, she mentioned me, ma'am, I want to start something to relieve from my menopausal symptoms, hot flushes I am getting. She is 52 and but I don't want to start any hormone therapy. I have read too much in the Google that there are a lot of problems, and I am a family history of varicose veins also. Though she is a lean, thin, a very smart lady, but the patients are also so much aware these days. They come after Googling and reading all that.
Yeah. So then what did you do? What did you prescribe her?
I started some herbal preparations, ma'am. I explained her everything because patient herself has come with all the reports. She has done the lipid profile. So I started, I explained her about some lifestyle modifications and herbal preparations I have started.
Nice. And also you can prescribe her, that gabapentin, which is very good for her black and her vasomotor symptoms, and also NSRH, then SSR inhibitors, they also work very good. They are non-hormonal.
Yeah. And the gabapentin, I just recollected. I told her about that your vitamin B12 is also less. So I'm writing something in the combination, so you won't feel bad. So she immediately what I wrote, and she was waiting outside. And after another patient I finished, she told my receptionist, I want to have a word with ma'am. So I told her, okay, send her. Then she told me when she came inside, Madam, I have just read this gabapentin earlier. One of my physician has given to my mom. My mom was feeling so sleepy and all that. So, will all that be going to happening to me? So I told every time is not like that. You are healthy and you are having some tingling sensation and all that. That will give you the combination will be much better. Instead of taking 2 tablets, you will get all in one tablet. So she told me, what other preparation, what you have read, now I am fully agreed, but this gabapentin is not going in my brain.
Yes, unless you can motivate, patient will not be benefited. No?
Very true, very true.
They have to take it as she owes that.
Yeah, very true, ma'am. Ultimately, she was agreed. I have to explain her everything. Then she agreed. Yeah. Ma'am, there are some more questions. Our friend Dr. Chinwe has joined all the way from Africa. Yeah, there's a comment. Very difficult to achieve a waistline of 35 centimeter and BMI of 25. Very true. Ma'am, there is one more question. Yeah. What kind of diet to be followed to maintain a good cardio health in menopause patient?
Yes, I didn't mention details because the time is limited, but you're absolutely right. We have to give our heart-friendly diet all the time. Well, first of all, it is important to look at what is the BMI. I mean, whether she's obese or not. If she's not obese, just as a prevention of the cardiovascular disease, we can ask her to get more fibrous carbohydrate rather than, bland carbohydrate. Fiber, more fiber containing carbohydrates is good, like brown bread, brown rice, like this way. And then of course the vegetables, that is the most important for the prevention of heart disease. And of course we have to cut down her fat level. I mean, if she takes the chicken, fine, but she has to remove the skin. I mean, without skin, she should take the chicken, birds, and they should reduce the red meat. In our country, too much red meat is being consumed. That has to be cut down. And yogurt is a very good. We know that cholesterol can be reduced. And some nuts are also very helpful. Orange is very helpful. Like this way, I mean, we have to balance in between the carbohydrate, protein, and fat and minerals. And we have to also keep in our mind that we have to always give her antioxidant because she's aging, she's getting menopause, so there's oxidative stress. So she can have the plenty fresh fruits, plenty fresh vegetables. And of course, I already mentioned that she should go for the meat, which is skinless, and white meat and fish. Thank you very much.
Yeah, thank you, ma'am. Yes, very correctly. Madam has covered all the points regarding this diet because these days when the patients are approaching us, first they want to know all about the dietary modifications.
Oil is important, Ritu. Yeah. I didn't mention that.
Yeah. So this is very, very important. Yes, we explain all the patients, yes, less oil, less fat in the diet, lot of antioxidants. Additionally, as madam has mentioned also, this lot of seeds are also very good. So means especially I give in my prescription, I always advise the patients to have some of kind of pumpkin seeds and flax seeds that are also very, very good. And patients are also very happy in taking the med. And madam, the supplements, like as you told us, we are also giving the more or less the same things, the black cohosh, red clover, soya extracts. And some patients we are giving, ma'am, this moringa leaves extracts are also available here.
Oh, that's nice. That's nice.
So that is also very, very good.
But one thing, Dr. Ritu, if somebody is having, I have shown you the cardiovascular assessment, high risk, medium risk, and low risk. If the medium risks women are coming to us, it is not better to avoid the herbal because still we don't have in our hand the evidence-based report for black cohosh or red clover, but the study is going on. Probably it will be published in the 2022. Then probably we will be happy to prescribe for the moderate type of risk. But no risk, yes, definitely herbal is very good for them.
Yeah, thank you, madam. Madam, as my program name is the Icons in Conversation with Dr. Ritu. So now we have covered the academic questions. Now I'm going to ask you some non-academic questions.
Oh,
Yeah.
that's interesting.
So you have to answer all these questions in one word and don't take much time to think. This is a rapid fire round.
Oh my God, I didn't know that.
That's the surprise.
I'm not very good in those.
But that are very simple questions. Coming to the first question, your favorite fruit?
Actually, I love guava,
Okay, great. Your favorite color?
purple.
Wow. And what thing about you are passionate?
Well, actually, I'm really passionate in, the women's rights, it's my passion. Wherever I see the women are oppressed, even the young, small girl to the elderly women, I just try to overcome those. Though I can't do sometimes, but this is my passion, to help the women to raise their voice, to liberalize them. This is my
Okay.
passion.
Okay. Ma'am, which is your favorite ice cream?
Well, actually, chocolate.
Oh, wow. Okay.
And chocolate is very healthy for the heart. One
Yes.
piece of chocolate prevents.
Yeah, dark chocolate. Yeah.
And if you laugh and laugh, that's why I told you that the women should be advised to take their own care. They should love themselves. If you laugh, loudly, that will also help your heart to breathe more.
Very true. Very true. Madam, you are as a role model for many of us doctors.
Oh, that's.
So, ma'am, is it you want to give any message to the upcoming doctors who see you as a role model? Ma'am, I have heard your so many lectures. It was like my dream coming true that I have invited you on my programs. So
Thank you so much.
earlier also I have done 2-3 webinars with you. All had gone very nice. So, ma'am, please give some message to doctors.
Thank you so much. Actually, I love the women. I told you, and I am proud of being a woman. And I love my mom is my women, me, my daughter, and you all. Everybody are women. And without women, the world will extinct. So we have the power. So we have to generate this power, and we have to disseminate this power to everyone. With our light, the whole world will be lightened. And that is my dream. And I hope we shall overcome all the odds. That is and for the younger doctors, yes, I have seen from Bangladesh, some doctors also join, Begum Hosneara, I can see. Well, for younger doctors, the one thing that they have to enjoy what they're doing is gynae or pediatrics or whatever it is, they should enjoy. They should think that that is in their heart. And each patient is nobody but her mom or dad or her brother or sister. Each patient is a living book. So if you are dedicated ourselves to the patient service, we will learn more. And that is actually satisfaction.
Yeah, thank you. Thank you so much, madam. Ma'am, any of your childhood memory you want to share with us?
Actually, there are a lot of childhood memory, but definitely I'm proud of my, the freedom fight of country.
Okay.
I salute all the freedom fighters of Bangladesh who have dedicated their lives for the country, for the language. And Dr. Ritu, I'm proud of that. I was the witness of that time. I was a little baby, but I saw the fighters are fighting and they own the country with the flag and with our language. That is my most beautiful memory in my life. My childhood life. Thank you for asking that question.
Great. Ma'am, any of the interesting places where you have visited, you want to mention it? One place where you have visited that is very interesting.
Well, there are a lot of places. Starting from scenic beauty, but I don't know why I really, really love to go to Paris several times. Okay. I don't know. It's wonderful. Whenever I touch the Switzerland and Paris, I feel that I am near to God. I am near to the horizon of beyond the limit. It's a wonderful feeling. So I love Paris and Switzerland. These two. Okay. Sorry to say. European countries.
That's great, ma'am.
It's just like, you are just in the nature. You're listening to the whispers of nature, the tranquility, the peace. It's wonderful feelings that you are near to creature.
Great. Now, ma'am, would you like to teach us one word in Bangla? Any one word? Because as in our India, we greet everyone as namaste. In your country, you greet, as I remember, the salam alaikum, or any or any one word you want to teach us in Bangla.
Yeah, I love you really bhalobashi. Do you know what is that?
Yeah.
What is that?
Good, na? It means.
It means
Are you speaking sweet? No.
Bhalobashi. This means love.
Okay.
Love for everyone.
Okay.
Everyone.
Okay.
And from the bottom of heart, Ritu, love is the bhalobashi.
Love is the bhalobashi. So thank you so much, ma'am, for enlightening all of us.
And thank you to you and all the friends who joined with us today in this meeting. And I'm really happy to discuss with lots of questions they ask.
Yeah.
And I really salute you for your wonderful innovation, initiative to this conversation with the icon. And you have you have some other question too. It's really very, very interesting. Thank you so much.
You. Because ma'am, every time we are asking the academic questions. So this program is focused on single faculty. We will know about the academics also and some non-academic insights also.
Oh, it's wonderful. Thank you so much, Ritu, and all the team, Nishant, everyone. As my heartiest gratitude and thanks.
Thank you so much, madam. And
okay.
Thank you, Nishant also, and thank you, Chitra and whole Shield Connect team. And thank you to all of my dear friends who have joined all across the geography. Yeah, over to you, Nishant, for the concluding remarks. You are muted, Nishant. Yeah, Rekha
Yes.
Friends are joining still.
Okay.
Yeah.
So thank you so much all to join for today's session, and I also thank to our speaker of the day, Dr. Zina. She gave a good speech on the topic also, as well as on the how to treat the patient as a family member to the new generation of doctors. So thank you so much, ma'am. So thank you. I thanks all the participants. Thank you.
This is the wind up for the today. So friends, don't forget to join us on next Thursday, 8 p.m. We are having Dr. Abu Bakar with us on a very interesting topic, the cesarean section scar defect, how to diagnose sonographically and clinically. So do join me on next Thursday, same time, 8 p.m. Indian Standard Time. Bye-bye.
Bye-bye, everyone.
Bye. Bye.